Welcome to another episode from the Veterinary Research Channel. Today, we delve into an intriguing case report that highlights an uncommon cause of acute abdominal pain in dogs, seminoperitoneum. This condition, characterized by the presence of spermatozoa within the peritoneal cavity, is rare, especially in vasectomized dogs. This episode will explore a specific instance of seminoperitoneum in a vasectomized German shorthaired pointer, shedding light on the complexities of diagnosis and treatment. Our story begins on July 4, 2022, when an 8-year-old male German short-haired pointer was rushed to the University of Wisconsin Veterinary Care Emergency Service. The presenting complaint was acute abdominal and testicular pain. The dog exhibited kyphosis, a stilted gait, and excessive panting. Adding to the complexity, the dog had a history of vasectomy performed at an unknown age under previous owners. Upon examination, the veterinary team noted several key clinical signs. The dog displayed abdominal pain, an enlarged and painful left testis, scrotal edema, and a non-painful, enlarged prostate. These findings prompted a series of diagnostic investigations to determine the underlying cause of the dog's distress. Initial point-of-care ultrasound revealed scant peritoneal effusion, while abdominal radiographs indicated prostatomegaly. Subsequent abdominal ultrasound provided more detailed insights. The prostate appeared enlarged and heterogeneously hyperechoic, featuring smooth margins and multiple small, round anechoic structures. Notably, the ultrasound also confirmed a small amount of anechoic free fluid within the peritoneum and retroperitoneum along the left kidney. This fluid was then aspirated for further analysis. Further examination of the urogenital system via ultrasound revealed that the testes were subjectively enlarged with heterogeneous echotexture. The epididymides were also enlarged and heterogeneously hypoechoic, exhibiting moderate flow on color Doppler. Moreover, the ductus deferens appeared markedly enlarged and tortuous at the level of the testicles, with ill-defined proximal portions. Based on these imaging results, the veterinary team formulated several potential diagnoses. These included bilateral orchitis and epididymitis, potentially stemming from infectious, bacterial, fungal, or viral or non-infectious inflammatory etiologies. The possibility of an infiltrative neoplastic process was also considered. The enlarged ductus deferens were suspected to be linked to the dog's prior vasectomy or inflammation related to the orchitis and epididymitis. The prostatic changes were suggestive of benign prostatic hyperplasia and prostatic cysts, though prostatitis could not be definitively ruled out. The abdominal ultrasound also revealed other findings. The spleen appeared mildly and diffusely heterogeneous, possibly indicating splenic extramedullary hematopoiesis or lymphoid hyperplasia, though infectious splenitis or an infiltrative neoplasm were also considered. The caudal pole of the left adrenal gland was mildly enlarged, which could have been a normal variant or indicative of functional or non-functional nodular hyperplasia, adenoma, or neoplasm. The right adrenal gland showed a small hyperechoic focus, likely representing dystrophic mineralization or fibrosis. Importantly, the liver, gallbladder, kidneys, urinary bladder, pancreas, gastrointestinal tract, and lymph nodes appeared normal. In addition to imaging, comprehensive blood work was performed, including a venous blood gas, biochemical profile, and complete blood count. The alkaline phosphatase activity was moderately elevated. Differentials for this increase included primary and secondary hepatopathy and hyperadrenocorticism, considering the mildly enlarged left adrenal gland. A urinalysis and urine aerobic culture were also conducted. The results showed a pH of 8.0, elevated protein levels, a specific gravity of 1.054, and minimal red and white blood cells. No bacteria were observed, and the urine culture showed no bacterial growth. Cytologic analysis of the peritoneal effusion revealed a highly cellular sample dominated by poorly preserved neutrophils. Notably, some neutrophils contained phagocytosed sperm heads, sperm tails, or both. Many free sperm heads, with and without tails, were also observed in the fluid background. Based on these findings, the interpretation was seminoperitoneum with marked neutrophilic inflammation. The peritoneal effusion aerobic culture and serum Brucella canis rapid slide agglutination test were both negative. With a diagnosis of seminoperitoneum established, the dog was hospitalized in the intensive care unit. Treatment included intravenous fluids, fentanyl infusion for pain management, and enrofloxacin to combat potential infection. The following day, the dog showed significant improvement. Abdominal and testicular pain had resolved, and scrotal edema had diminished. Point-of-care ultrasound indicated that peritoneal effusion was no longer detectable. Given these positive changes, the dog was discharged with a 3-week course of oral enrofloxacin for prostatitis and periorchiepididimitis. The patient was castrated after completion of antibiotic therapy with complete resolution of clinical signs. Seminoperitoneum, as highlighted in this case, is an uncommon condition in dogs. It is characterized by the presence of spermatozoa within the peritoneal cavity. Spermatozoa are normally immune-privileged due to the blood-testis barrier. When this barrier is disrupted, the immune system can react. The case of the German short-haired pointer is particularly interesting given the dog's history of vasectomy. Vasectomy involves the disruption of the ductus deferens and is an uncommon surgical sterilization technique in dogs. While vasectomy does not hinder steroidogenesis, orchiectomy is generally the recommended alternative, as it reduces unwanted sexual behaviors and androgen-dependent diseases. Complications associated with vasectomy in dogs can include orchitis, hydrocele, incisional complications, and recurrent autogenic scrotal dermatitis. Spermatoceles and sperm granulomas are also potential complications. In this particular case, the seminoperitoneum may have resulted from direct extravasation of spermatozoa into the peritoneal cavity following the vasectomy. The enlarged epididymides and ductus deferens observed in this case could have been evidence of spermatoceles. The cytologic evidence of extracellular and phagocytosed spermatozoa in the peritoneal effusion likely contributed to the peritoneal inflammation and effusion formation. This may also have been responsible for the German short-haired pointer's acute abdominal pain. The pathophysiology of seminoperitoneum, in this case, was not definitively determined. While bilateral orchiectomy with histopathology would have provided more detail, this information was unfortunately lost to follow-up. Nevertheless, this case underscores the importance of considering seminoperitoneum in vasectomized dogs presenting with acute abdominal pain or peritoneal effusion. Abdominal ultrasound and ruling out peritoneal effusion or other intra-abdominal abnormalities should be considered in vasectomized dogs presenting with urogenital abnormalities. This case is the second known reported seminoperitoneum in a vasectomized dog. The first known report was of an adult male Weimaraner with a history of intra-abdominal vasectomy that described a seminoperitoneum and inflammatory peritoneal effusion. In conclusion, the case of the German short-haired pointer serves as a valuable reminder of the diverse etiologies of abdominal pain in dogs. Seminoperitoneum, though rare, should be considered, especially in vasectomized animals presenting with relevant clinical signs. A thorough diagnostic approach, including imaging and cytologic analysis, is essential for accurate diagnosis and appropriate management. Thank you for listening to the Veterinary Research Channel. A link for the reference paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.